Rich, thank you so much for coming in today and being willing to sit down and have a chat. You are a longtime patient and somebody that I really did want to have a conversation with because we go back quite a long ways. So can you remind me, I know approximately when you first became a patient. I was in San Francisco in my clinic there, but tell us about what brought you in and roughly when that was.
Well, the interesting thing was I didn't even know about you until you did a wellness clinic at my employer, which was Booz Allen Hamilton downtown in San Francisco. And you brought to light for me a whole raft of very interesting perspectives on natural healing, preventative medicine, very osteopathic kind of ideas that I hadn't considered very often. I was very, very much a product of what I'd experienced before, and in my 23 years in the Marine Corps, was very much MD type, heavy on medication and not much on anything else. Just kind of force feed the patient what they want to get them where you want them to be as fast as you possibly could, and perhaps not consider the long-term outcome as much as you expressed to me.
And long-term outcome could mean, well, the negative benefits of having those sorts of treatments, right? Just drug therapy.
I like negative benefits. It's kind of a opposite kind of thought.
I'm glad. Anyone who sees this is going to know this is a smart guy.
Okay.
But the positive benefits that now we're in line, right, would be maybe not as much as what you can get when we sit down and we say, let's identify what's going on, right? Let's understand the cause here and what you're dealing with and come up with a plan. What's our approach to actually change that and improve that?
It was a particularly important thing for me at the time. I had been suffering for about 7 years from a sacroiliac strain that 3 or 4 times a year had knocked me completely out of commission for 1 to 2 weeks at a time. I could barely walk. And the first time you adjusted me was shortly after one of those episodes, and it was immediately effective. And we talked more about it, got into the history of what it was and what I'd been treated with prior to that, mostly a little bit of massage therapy, a lot of drug therapy, some of which worked and some didn't, and expectation of quick results. You're outlining a more holistic form of treatment really made sense to me, and what we did was I came to see you for an adjustment almost twice a week for a month or two, and then combined that with massage therapy twice a week for a month or two, along with a little bit of physical therapy, ice, and really a lot of stretching and other things that I could do for myself besides having a provider give them to me. That made just the world a difference. And I'd like to thank you very much, because in the 17 years since we did that, I have had perhaps 3 or 4 of those episodes instead of 3 or 4 a year.
Right.
And those have been a game changer for me, a big change in my life, and the reason why I'm still coming to see you 17 years later.
And I mean, I'm so flattered that you came to see me in San Francisco. Then when I moved out here to Concord, you followed me from here, and you're coming a distance too. So that's...
I drive here from Alameda, where I work, and round trip, it's 72 miles, but that doesn't matter. Okay.
Thank you.
Nice thing is I have a plan which reimburses me for some of that mileage, which makes it a little bit easier.
Right.
But even if it was 0, I'd still come, because you are the best provider I've had since I've been living back here in California.
Thank you so much. One of the things I want to touch on is, I think when we're working with appropriate care, we started out, we identified some issues, and we came up with the plan, and that was a couple of times a week, right, for a while of treatment. Then as you progress, we get to a point where we say, okay, now I'm very stable. Whatever I have that we identify in x-ray and from exam is not progressing, at least not rapidly. So we don't need to be treating quite as much, but we do periodic re-examinations, right? We do periodic re-x-rays so that we can stay on top and not just close our eyes and ignore that as time goes on and as we age, the spine, like the rest of the body, also ages and will degenerate. So we get to points where we discover something's happening and then we increase the treatment a little bit, right? And we've had periods like this.
And one of those manifestations of time going by is that I used to be 6'2". Now I'm 6 foot tall. And when you get to be my age, that's going to happen.
Yeah.
But thankfully, it doesn't come at a cost in pain or disability. It comes with a continuation of activity and enjoyment and a lot of fun. My wife and I just love to be as active as we can. And those things are helped by a holistic approach to wellness, not only in what we do here in the physical means of manipulation or anything else, but in diet, in selection of more homeopathic type of nutritional supplements and things like that. And
which we've talked about a lot, right?
You've helped me a lot. One of the things that I also suffer with, maybe hereditarily, is a little bit of a elevated blood sugar level. And you started me on a course of niacin 4 years ago, and my numbers have dropped every time that I've taken, and I just had my results today. Every time I've got my labs done for my annual physical, they've gone down a little bit. And I think that pursuit of that one treatment has helped me more than anything, because I haven't really changed my diet. I still enjoy myself a lot. Okay,
good for you.
But it's not hurt me, and certainly my MD is considering putting me on some sort of medication for that. But having discussed with you all of the things which go into those calculations and those numbers, which are a bit beyond me, I am more in line with your thinking that this is not something to get uber excited about, because it is still very, very low on the getting towards a number to be concerned about. It's not at the number yet. And I think one of the things I appreciate most about that is that my MD might be very constrained in what she can and cannot say by her company.
Yeah,
okay?
she works for a
She
corporation.
works for a corporation, and they kind of tell her what she can and cannot do. And I love her. She's fantastic. You, however, are pretty independent.
I'm my own corporation.
You're your own corporation, and you base your opinions and your, let's say, observations on what you have discovered through your more than 17 years of doing this.
There are so many options. I mean, we know, a medication can be offered, and more than likely there is another way to go about it. So I love working with you because you're interested in finding the other way. You don't just want to automatically accept whatever is thrown at you. I do want to touch on, two things. One is you talked about the activities, how you enjoy life, what you and your wife do together. And that's so important, because from my perspective, when a patient comes in and we're trying to make progress, a lot of times, especially if they're in pain, all they want to do is sit on the couch and be very inactive, right? And when we can work as a team, and I can say, look, there are a few exercises that would really help you, and you will do them, or you know what, for right now, you need to avoid certain things, and you will do it. Boy, we make much more progress and much more quickly, right?
I think you said a long time that motion is lotion.
Yeah.
And I really believe in that.
Yeah.
And staying active is the most important thing you can do, because you just start to freeze up as inactivity, let's say, creeps into your schedule. So I'm very, very fortunate that my wife is 14 years younger than I am. And she really keeps me on my toes. And whereas I ride the cart when I play golf now, she runs on the course.
Fantastic.
So she keeps me really going. It's fun.
Fantastic.
It's really fun.
Are there any other conditions or situations that arose over these years that come to mind for you that we worked on together?
Well, right now I'm just starting to develop some arthritis in my knees, which has really slowed me down the last few months. But I've really, really appreciated bringing the results of what testing and the observations of my other doctors to you for, I wouldn't necessarily say a second opinion, but certainly a clarification of what these things mean in a more holistic manner. and it's been very, very helpful to me, and I really look forward to continuing.
And I'm so happy to do it.
Yeah.
Rich, I appreciate it. You're the type of patient that I love to have come in. You always bring good energy, so you arrive, it's like, yay, Rich is here. And I look forward to the next 17 years.
Thank you very much.
Thank you.
Take care.
You too.